Innovation, research, medical cases, formulations, mechanisms. We decode all the medical advances. Welcome to Drugs Decode. Every breath matters, especially when you're battling a life-threatening lung infection. As traditional antibiotics begin to fail us due to rising resistance and limited lung penetration, a smarter, targeted approach is gaining attention: inhalable antimicrobials. In this video, we explore how inhalable antibiotics are revolutionizing respiratory care, from how they work, to where they're used, to what challenges they face. This is your deep dive into one of the most promising tools in modern medicine: the global lung infection crisis. Lung infections are among the leading causes of death worldwide. Lower respiratory tract infections kill over 2.5 million people each year. In hospitals, especially in ICUs, patients on ventilators are at high risk for drug-resistant infections. Even in outpatient settings, conditions like cystic fibrosis, COPD, and bronchiectasis often come with recurring bacterial lung infections. Unfortunately, our first line of defense, systemic antibiotics, is increasingly falling short. Systemic antibiotics, whether oral or intravenous, face a big challenge when it comes to treating lung infections. The lungs are designed to keep things out, including helpful drugs. Thick mucus, epithelial barriers, and immune cells often prevent antibiotics from reaching infection sites. To compensate, higher doses are used, but this leads to toxicity and unwanted side effects. Worse, these suboptimal drug levels in the lungs may drive antibiotic resistance. It's a classic lose-lose. Enter inhalable antimicrobials. These drugs are formulated to be inhaled directly into the lungs, targeting the site of infection without traveling through the bloodstream. This local delivery allows for high drug concentrations in the lungs, with minimal exposure to the rest of the body. There are several ways to deliver these inhaled therapies. Nebulizers, example, inhaled Tobramycin or Colistin. Dry powder inhalers, example, ciprofloxacin. Liposomal formulations, example, Liposomal Amikacin for MAC infection. Particles are designed to be small, 1 to 5 microns, to reach the alveoli. Some are encapsulated in liposomes for extended release and deeper penetration. This targeted approach changes the game. So where are inhaled antibiotics being used today? Let's look at some real-world examples. Cystic fibrosis. Inhaled Tobramycin is used long-term to suppress Pseudomonas aeruginosa. It helps improve lung function and reduce hospitalizations. Non-tuberculous mycobacteria, NTM. Liposomal amikacin is used for hard-to-treat Mycobacterium avium complex infections, especially in patients who didn't respond to systemic therapy. Bronchiectasis. Patients benefit from inhaled ciprofloxacin or gentamicin to reduce exacerbations and bacterial load. Ventilator-associated pneumonia, VAP. In ICU settings, inhaled Colistin or amikacin can be life-saving when IV options fail. Clinical trials show better symptom control, fewer exacerbations, and less systemic toxicity. Despite the advantages, inhalable antimicrobials face several challenges. Some formulations are unstable in humidity or require complex storage. Patients may experience side effects like bronchospasm or throat irritation. There's also the risk of poor adherence. Patients may not use their inhalers correctly or consistently. And, like all antimicrobials, there is the concern of resistance developing with long-term use. However, most of these can be addressed through better device design, clinical monitoring, and patient education. Looking ahead, the future of inhaled antibiotics is bright. Smart inhalers are being developed to monitor patient usage and optimize dosing. Nanoparticle drug delivery systems could offer even better lung penetration and controlled release. We may soon see personalized inhaled therapies based on each patient's lung microbiome and immune profile. Researchers are also exploring combinations, antimicrobials with anti-inflammatories, to manage chronic infections more effectively. Inhalable antimicrobials are more than just convenient. They are targeted, efficient, and crucial in the fight against antibiotic resistance. They're already transforming treatment in diseases like cystic fibrosis and NTM infections, and new applications are emerging every day. If you're in healthcare, it's time to pay attention to this game-changing class of therapy. If you found this video informative, please like, share, and subscribe to Drugs Decode for more clinical insights. Thank you for watching, and remember, smarter delivery can mean better recovery.